Welcome to our exploration of autonomic pharmacology. To begin, let's look at the basic structure of the nervous system. The nervous system is divided into two main parts, the central nervous system, or CNS, and the peripheral nervous system, or PNS. The CNS includes the brain and spinal cord, serving as the main control center for the body. The PNS, on the other hand, connects the CNS to the rest of the body through a network of nerves. This division is crucial for understanding how signals travel and how different parts of the body communicate and respond to various stimuli. The central nervous system, as mentioned, is made up of the brain and spinal cord. It processes information and coordinates activity throughout the body. The peripheral nervous system consists of nerves that branch out from the CNS. These nerves are further divided into afferent, or sensory neurons, which carry information to the CNS, and efferent, or motor neurons, which carry commands from the CNS to muscles and glands. This organization allows for efficient communication and control of bodily functions. The peripheral efferent system is further divided into the somatic nervous system and the autonomic nervous system. The somatic system controls voluntary movements, such as those involving skeletal muscles. Think of actions like walking or breathing. In contrast, the autonomic nervous system manages involuntary functions, such as heart rate, digestion, and glandular activity. This distinction is fundamental for understanding how the body maintains both conscious and unconscious control over its functions. Let's compare the somatic and autonomic nervous systems. The somatic system is under conscious control, allowing us to move our skeletal muscles at will. It consists of a single motor neuron and always results in excitation. The autonomic system, however, operates unconsciously, regulating visceral functions like heart rate, temperature, and metabolism. It uses two neurons in series and can have both excitatory and inhibitory effects. This duality ensures the body can respond appropriately to different internal and external conditions. The autonomic nervous system, or ANS, is responsible for involuntary automatic actions. Its nerves are composed of two types of neurons, preganglionic, which are myelinated, and postganglionic, which are not. This structure allows for rapid and efficient transmission of signals to various organs, ensuring that vital functions like heart rate and digestion are maintained without conscious effort. ANS is further divided into the sympathetic and parasympathetic nervous systems. The sympathetic division, also known as the thoracolumbar division, originates from the thoracic and lumbar regions of the spinal cord. The parasympathetic division, or craniosacral division, arises from the cranial and sacral regions. Each division has distinct roles in regulating bodily functions, often working in opposition to maintain balance. Enteric nervous system is sometimes considered a third division of the ANS. It consists of a network of nerve fibers that innervate the gastrointestinal tract, pancreas, and gallbladder. Often referred to as the brain of the gut, it functions independently of the CNS, controlling motility, secretions, and blood flow within the digestive system. However, it is still influenced by both the sympathetic and parasympathetic systems. Autonomic ganglia are clusters of nerve cell bodies. Sympathetic ganglia are typically located near the vertebral column, with short preganglionic and long postganglionic fibers. Some exceptions exist, such as ganglia near the urinary bladder and rectum. Parasympathetic ganglia, in contrast, are found close to or within the organs they innervate, featuring long preganglionic and short postganglionic fibers. This arrangement supports the specific functions of each division. The sympathetic nervous system is essential for regulating the cardiovascular system. It increases cardiac output and causes vasoconstriction, helping to maintain blood pressure and distribute blood flow as needed. Additionally, it plays a role in regulating body temperature by controlling blood flow to the skin, promoting sweat secretion, and inducing piloerection, which helps conserve heat. These functions are vital for adapting to changes in the environment and maintaining homeostasis. One of the most well-known roles of the sympathetic nervous system is implementing the fight or flight response. When activated, it increases heart rate and blood pressure, redirects blood from the skin and internal organs to skeletal muscles, dilates the bronchi for better oxygenation, and dilates the pupils for improved vision. It also mobilizes stored energy, providing glucose for the brain and fatty acids for muscles, preparing the body to respond to stress or danger. In contrast, the parasympathetic nervous system is responsible for maintaining essential bodily functions, especially during rest. It supports digestion, waste elimination, and other processes required for life. Typically, it acts to balance or oppose the actions of the sympathetic system, being dominant in rest and digest situations. This balance ensures the body can recover and maintain internal stability after periods of stress. The parasympathetic system slows the heart rate, increases gastric secretions, and facilitates emptying of the bladder and bowel. It also helps focus the eyes for near vision, constricts the pupils, and contracts bronchial smooth muscle. Essentially, it handles the body's housekeeping chores, like digesting food and excreting waste, while also conserving energy by reducing cardiac workload and supporting vision control. Autonomic innervation patterns can be dual or single. Dual innervation means an organ receives input from both sympathetic and parasympathetic systems, often with opposite or complementary effects. For example, the heart receives both types of input, allowing for fine-tuned control. Some organs, like the adrenal medulla or most blood vessels, receive input from only one division, typically the sympathetic system. This arrangement ensures precise regulation of vital functions. Dual innervation can result in opposite actions, such as the sympathetic system increasing heart rate while the parasympathetic system decreases it. In some cases, the two systems work together for complementary actions, like in the male reproductive system. Single innervation, where only one division is involved, is seen in structures like sweat glands and most blood vessels, which are primarily controlled by the sympathetic system. Neurotransmission in the peripheral nervous system occurs at three major sites: preganglionic synapses in both sympathetic and parasympathetic systems, postganglionic neuroeffector junctions, and somatic motor end plates on skeletal muscles. Most postganglionic parasympathetic neurons are cholinergic, meaning they use acetylcholine as a neurotransmitter. All preganglionic efferent autonomic fibers are also cholinergic, ensuring consistent signal transmission. Cholinergic neurons synthesize, store, and release acetylcholine, while adrenergic neurons handle norepinephrine. Cholinomimetics are agents that mimic acetylcholine, and adrenomimetics mimic norepinephrine. Each has specific receptors, cholinorceptors for acetylcholine and adrenoceptors for norepinephrine and epinephrine. Antagonists can block these actions, providing important pharmacological tools for regulating nervous system activity. Regardless of the neuron type, the fundamental steps in chemical transmission are similar. These include synthesis, storage, and release of the neurotransmitter, interaction with receptors, rapid removal of the transmitter, and recovery of the effector cell. Each step represents a potential site for pharmacological intervention, allowing for precise control over nervous system activity. Acetylcholine, ACH, is synthesized in cholinergic neurons from acetyl-CoA and choline, catalyzed by the enzyme choline acetyltransferase. Acetyl-CoA is produced in the mitochondria, while choline is transported into the neuron. This process can be inhibited by certain drugs, affecting neurotransmitter availability and consequently nervous system function. After release, acetylcholine binds to cholinesterase and is eventually degraded by acetylcholinesterase, AChy, into choline and acetate. Choline is then recycled back into the neuron. This rapid breakdown ensures that signals are brief and precise, preventing overstimulation of the target cells. There are two main types of cholinesterase enzymes: true cholinesterase, found in neurons and effectors, and pseudocholinesterase, found in plasma, liver, glia, and other tissues. True cholinesterase specifically metabolizes acetylcholine, while pseudocholinesterase can act on a variety of ester compounds. Both play important roles in regulating neurotransmitter levels. Adrenergic neurotransmission involves more complex steps. Synthesis of norepinephrine, NE, begins with the amino acid tyrosine, which is converted into DOPA, and then into NE. This process is tightly regulated, with specific enzymes controlling each step. Removal of NE from the synaptic cleft can occur through reuptake, diffusion, or enzymatic degradation, ensuring precise control over signal duration. Actions of norepinephrine NE and epinephrine EP are terminated by three main mechanisms: neuronal reuptake, diffusion into the circulation, and enzymatic degradation. Neuronal reuptake is the most important, as NE-EP is transported back into the neuron for reuse or breakdown. Enzymes like catecholomethyltransferase, COMT, and monoamine oxidase, MAO, further metabolize these neurotransmitters, ensuring their effects are tightly regulated. COMT is a highly specific enzyme that acts on substances with a catechol ring, such as NE and EP, reducing their activity significantly. MAO, on the other hand, is less specific and can metabolize a variety of amines, including dopamine and serotonin. Both enzymes are essential for the breakdown and inactivation of catecholamines, ensuring that neurotransmitter signals are brief and controlled. Autonomic receptors are specialized proteins that respond to neurotransmitters. They can be divided into four main families: ligand-gated ion channels, G-protein coupled receptors, enzyme-linked receptors, and intracellular receptors. Each type plays a unique role in how cells respond to signals from the nervous system, allowing for a wide range of physiological effects. Ligand-gated ion channels regulate the flow of ions across cell membranes. When a ligand binds to the channel, it opens, allowing ions to pass through and rapidly change the cell's electrical state. This mechanism is crucial for fast synaptic transmission, as seen with nicotinic acetylcholine receptors and GABA receptors. The response is almost instantaneous, lasting only a few milliseconds. G-protein coupled receptors, GPCRs, are another major receptor family. They consist of a single peptide with 7 membrane-spanning regions and are linked to G-protein. When a ligand binds, the G-protein is activated, leading to the production of secondary messengers like CAMP, IP3, and DAG. These messengers then activate kinases, which phosphorylate proteins and trigger various cellular responses. Secondary messengers, such as CAMP, IP3, and DAG, are produced when GPCRs are activated. These molecules amplify the signal inside the cell, leading to a cascade of events that result in physiological changes. For example, CAMP is produced by adenyl cyclase, while IP3 and DAG are generated by phospholipase. These messengers play a crucial role in translating external signals into cellular actions. Cholinergic receptors are divided into muscarinic and nicotinic types. Muscarinic receptors are GPCRs found in many visceral organs and are further classified into M1, M2, M3, M4, and M5 subtypes. M1, M3, and M5 activate the IP3 and DAG pathways, leading to increased glandular secretion and smooth muscle contraction. M2 and M4 inhibit adenylyl cyclase, reducing cellular activity. Nicotinic receptors are ligand-gated ion channels activated by acetylcholine or nicotine. They are composed of 5 subunits arranged around a central pore, which becomes permeable to sodium and calcium ions when activated. This results in depolarization and excitation of the cell. Nicotinic receptors are found at autonomic ganglia, NN, and neuromuscular junctions, NM, playing key roles in both autonomic and somatic nervous systems. Adrenosters interact with norepinephrine, epinephrine, and related drugs. They are classified into 2 main types, alpha-alpha and beta-beta receptors, each with subtypes. Alpha-1 receptors are found on postsynaptic neurons, while alpha-2 are mostly presynaptic and involved in feedback inhibition. Beta-1 receptors are mainly in the heart and fat cells, while beta-2 are found in bronchial smooth muscle, brain, liver, and skeletal muscle blood vessels. Pharmacology of the autonomic nervous system involves drugs that can mimic or block the actions of neurotransmitters. Cholinomimetic drugs, for example, produce effects similar to acetylcholine and are classified as either direct-acting receptor agonists or indirect-acting acetylcholinesterase inhibitors. Understanding these drugs is essential for managing conditions related to autonomic dysfunction. Choline esters are a group of drugs that activate muscarinic or nicotinic receptors. They are polar compounds that poorly cross the gastrointestinal tract and blood-brain barrier. Their duration of action varies, with acetylcholine having an ultrashort action, methacholine intermediate, and bethencoal and carbachol having long actions. These differences are important for their clinical use. Synthetic choline esters, such as methacholine, carbachol, and bethencoal, are derivatives of acetylcholine. They have several advantages over natural acetylcholine, including longer duration of action, effectiveness when taken orally or by injection, and greater selectivity. These properties make them valuable tools in clinical practice for targeting specific autonomic functions. Choline esters have notable effects on the heart, including negative chronotropic, slowing heart rate, dromotropic, slowing conduction, and inotropic, reducing contractility effects. These actions are important for managing certain cardiovascular conditions and highlight the significance of autonomic pharmacology in clinical medicine. Choline esters increase the amplitude of contractions and peristaltic activity in the stomach and intestines. They also enhance secretory activity in the gastrointestinal tract. These effects are particularly useful for treating conditions where increased motility or secretion is desired, such as certain types of constipation or digestive disorders. The genitourinary tract, choline esters can increase urethral peristalsis, contract the detrusor muscle of the bladder, and increase voluntary voiding pressure. They also decrease bladder capacity and relax sphincters. Drugs like carbachol and bethencoal are especially selective for stimulating the gastrointestinal and urinary tracts, making them useful for treating urinary retention and certain digestive issues. Muscarinic stimulants contract the smooth muscles of the bronchial tree and increase glandular secretions in the tracheobronchial mucosa. These effects can sometimes cause symptoms in individuals with asthma highlighting the importance of careful drug selection and monitoring in patients with respiratory conditions. The iris contains two types of muscles: the circular papillary constrictor, which has M3 receptors and causes meiosis constriction, and the radial papillary dilator, which has alpha-1 receptors and causes mydriasis dilation. The ciliary body also plays a role in vision, with the ciliary process secreting aqueous humor and the ciliary muscles adjusting lens shape for near vision. The ciliary body has two main parts: the ciliary process, which secretes aqueous humor, and the ciliary muscles, which have M3 receptors. When the parasympathetic system stimulates these muscles, the suspending ligament of the lens relaxes, allowing the lens to become more convex and shift forward. This adjustment is essential for focusing on near objects and maintaining clear vision. In summary, autonomic pharmacology covers the structure and function of the nervous system, the roles of neurotransmitters, and the mechanisms of drug action. Understanding these concepts is essential for appreciating how the body maintains balance and responds to internal and external challenges. This knowledge also forms the foundation for developing and using medications that target the autonomic nervous system. The clinical relevance of autonomic pharmacology cannot be overstated. Many common medications, such as those for blood pressure, asthma, and digestive disorders, act on the autonomic nervous system. By understanding how these drugs work, healthcare professionals can make better decisions for patient care and manage side effects more effectively. Research in autonomic pharmacology continues to evolve, with new drugs and therapies being developed to target specific receptors and pathways. Advances in molecular biology and genetics are providing deeper insights into how the nervous system functions and how it can be modulated for therapeutic benefit. The future holds promise for more precise and effective treatments. Key takeaways from this chapter include the structure and function of the autonomic nervous system, the importance of neurotransmitters, and the mechanisms by which drugs can influence these systems. A solid understanding of these principles is essential for anyone studying pharmacology or working in healthcare. Take a moment to review the main concepts covered in this chapter. Reflect on how the autonomic nervous system integrates with other body systems and how pharmacological agents can be used to modulate its activity. This holistic understanding will serve as a foundation for more advanced topics in pharmacology. In conclusion, autonomic pharmacology is a dynamic and essential field that bridges basic science and clinical practice. By mastering these concepts, you'll be better equipped to understand how the body works, how diseases affect autonomic function, and how medications can restore balance. Continue exploring and building on this knowledge as you advance in your studies.